All kids are fidgety and have difficulty sitting still depending on where they are and how engaged they are and how interesting they find the activity.
ADHD, or attention deficit hyperactivity disorder, is a set of disorders that describes kids that have challenges with hyperactivity, impulsivity, and possibly inattention.
So within hyperactivity, you'll see kids that are constantly in motion. So they might get up many times in the day to sharpen their pencil or go to the bathroom, but really this is more about they have difficulty sitting still. They don't walk anywhere, they run.
And then there's impulsivity, which is essentially related to poor impulse control, right? Saying and doing things without thinking. This could be things like interrupting a lot, blurting out, talking before people are done asking the question, darting out into the street.
The symptoms of inattention look like distractibility, daydreaming, some disorganization, so they'll complete the homework but will forget to turn it in. The backpacks will be full of papers, the desk will be full of pencils and pens, and it's very difficult to find things, which makes it very difficult to be productive.
We know that ADHD is a neurodevelopmental disorder, which is due to a chemical imbalance in the brain, but we don't know what causes it. Some research suggests that there may be an increased risk of a child developing it if their mom is smoking during pregnancy.
ADHD most commonly gets diagnosed around that kindergarten, 5-6 age. And the reason why is because that's the age where we really get to tease out just being a rambunctious, hyperactive young child to a child that's actually having difficulties in school at home because of ADHD.
Diagnostic criteria for ADHD is that it should be present in more than one setting. So for example, it should be at school and in home. The symptoms should persist for more than 6 months, and they should present before the age of 12 years. You should also make sure that these symptoms that they're presenting are excessive for their age, so they're not age appropriate. And also, other mental disorders should be excluded to make sure that that's not what's accounting for it. ADHD can be treated with medications, behavioral therapy, and organizational skills to help them succeed.
When we talk about stimulants, we talk about methylphenidates and we talk about amphetamine derivatives. And when we talk about non-stimulants, we talk about other medications that also deal with neurotransmitters, but work a little bit differently.
With regard to the behavioral interventions, there's a lot of things that parents and teachers can do to structure the child's environment in a way that really maximizes their ability to attend and get things done. There's also some emerging support for organizational skills training, actually training kids to manage themselves with regard to time management, planning, and organization. You know, I think one thing that I really like for parents to know about children with ADHD is that they will often become adults with ADHD. And this is important because the foundation that we set today for how they manage themselves, how they establish their own routines, their time management, their organization, their planning, how they resolve conflict, how they regulate their emotions, that essentially sets the tone for what they look like as adults.